Good morning for those of you in California. I am Lidia Schapira. I'm a medical oncologist at Stanford, where I also direct the Cancer Survivorship Program, and it is my pleasure to welcome you today. I'll be your host for this program. This is a series of 4 fireside chats with cancer survivors and Stanford faculty, and it's intended for any person living with or beyond cancer and caregivers. We know a diagnosis of cancer affects a person in many ways and presents many challenges that don't end with a last treatment. So today we'll explore these themes with 2 amazing guests who will share their stories and wisdom. But first, a word about our setup. This is a Zoom webinar. We have a chat function and we invite you to tell us where you're from in the chat. We also have a Q&A. And so please feel free to write your questions in English or Spanish as they come to you. At the bottom of the screen, you will see there's an icon that tells you that there is a language preference. We have 2 interpreters with us today. And so if your language preference is Spanish, please use the Spanish channel. And now let me introduce our guests for the program. Parul Somani is a business leader with experience in management, consulting, and operational roles at startups, and she is the founder and CEO of Silver Linings. Parul works with organizations to engage, educate, and empower their members to better navigate personal and professional uncertainty and challenges. As a cancer survivor and caregiver, Parul also advocates for patient empowerment, the power of genomics, and healthcare transparency and access. She authored a blog, New Job, New Baby, New Cancer, throughout her treatment. And this has now been read in more than 85 countries. And Parul has been honored by many cancer advocacy groups. She gives keynotes and advises early stage healthcare startups. And Martin Inderbitzin is a neuroscientist. He's an online content creator and an amateur triathlete, and he'll tell us more about that. In 2012, his dreams of a successful career were destroyed by a diagnosis of pancreatic cancer. And since then, he's been in and out of treatment to cope with his chronic disease. Based on his personal experience, he founded mysurvivalstory.org, an initiative that documents inspiring cancer survival stories around the globe with a goal of helping other patients and families to better cope with the challenge of cancer and its psychological effects. Martin also gives keynotes and workshops on the topics of mindsets and resilience around the world. So it is my great pleasure to have a chance to chat with both of you and welcome you again to this program. Martin, let me start with you. And let's start with the shock of receiving a cancer diagnosis. Can you take us to that time in your story and tell us a little bit about what it was like to hear that you have cancer?
Yes, sure. First of all, thank you very much for having me. It's a big pleasure to be here and also see so many people attending from so many different places. I'm happy to talk about that. Despite it's not an experience that is very comfortable. And probably those of you who are attending this webinar, this session, and have your own story, you know how it feels. It's, at least in my case, it was like somebody was just like pulling away the floor under my feet. So it was like kind of a free fall. And I felt like being in the wrong movie, just like getting totally overwhelmed emotionally and mentally. And I think that's why it's so cool that we're doing this kind of sessions, that we are able to talk about those topics, because so many patients, so many of us are experiencing those kind of emotions and states.
So one of the amazing parts of this is that you've always looked so well, Martin, and you look so strong and well and healthy. What is it like? What has it been like for you to give this appearance of health and strength when perhaps you were dealing with a lot of emotions and perhaps not feeling as strong as you looked.
Yeah, I think you raise a very important point, because what could happen is that it appears that everything is so easy. And I like to say in my talks and workshops always that everybody has a backstory. You know, what you see, let's say here on the camera or on social media, is not always the full story. And the backstory we all drag with us, and the backstory is tricky. It's complicated. It's not linear. It's chaotic, because cancer is chaotic. And I think in the moment when you accept that, then it's the first step that you actually can make a little step forward. So for me, it had a lot. I had to like, maybe I can talk also from a perspective of man. Like, we don't like to say we're wrong, or we're weak, or we are like vulnerable. And so it's like the first reaction that you say, no, I'm strong, I'm good, I can do this. Like, you want to push it through. And it took me probably 2-3 years until I could really say, okay, no, it's also okay to be not okay. And it's okay to cry. And it's okay to go to a psychotherapist and talk about all my emotions. And it was for me a development. It didn't came like straightforward, just like, okay, this is what I'm doing, and I'm just accepting it. So it was kind of a development, yes.
And Parul, you were first diagnosed just as you experienced an incredible joy in your life. Tell us a little bit about what that was like for you, and also if you experienced any shock at the time of your diagnosis.
Yes, it's a very vivid experience. I feel like almost every day of that time period, I can easily remember. I was actually 38 weeks pregnant when I initially felt a lump, and was immediately paranoid, but was told that it's likely nothing to worry about because I was pregnant. I was only 31 years old. I was young, and it was likely a clogged milk duct. But luckily we had kept this healthy paranoia alive of wanting it to be checked out. But I never made it to that appointment for that ultrasound and biopsy, because 2 days later, my water broke and my second daughter arrived 2 weeks early. I was still actually recovering from my C-section. And my husband wheeled me from the NICU to the neighboring breast clinic for this ultrasound and biopsy. And even then, the breast surgeon said, tissue feels soft, it's likely nothing to worry about. A couple of days later, my baby and I were both discharged with a clean bill of health from the maternity ward. And it was actually the weekend of Father's Day when I was home and I was holding my daughter, and I saw that this call was coming on a Saturday from the breast surgeon. And I just knew immediately that could not be good news, that she was calling on that day. I put my baby down, and I picked up the phone, and I was definitely in shock when she said that the mass is malignant after all, and that I had triple negative breast cancer, would require chemotherapy, bilateral mastectomy, and breast reconstruction. And all I could think of at the time was that I had just had a baby and I'm still recovering. And the instinct was honestly to go into warrior mode, because I just wanted to know what needed to be done and how we were going to get through this. But it was when I put the phone down and I turned to my mother, who happened to be there to help me because I had just had a newborn. And when I said to her, it's cancer, that's when I just started bawling.
Of course, of course. That's an amazing story, and one that is so incredibly moving. So, if you can bear to share with us, tell us a little bit about how you went from that moment of having sort of everything that was normal and joyful sort of collapse around you, and then sort of organize yourself to stay calm and face this new existential threat that was cancer.
So that first month, which for me was filled with wanting to get second opinions, better understanding the diagnosis and what the right place of the care team would be, was filled with all sorts of anxiety. You know, I was still trying to wean as I was trying to go for MRIs so we could fully properly understand the staging of the cancer. So that period was definitely very, very difficult, as it would be for anyone. What we found to be really helpful is my husband and I have always, you know, believed in the power of hope and the power of optimism, but have also believed that hope is not a course of action. And what empowered us during that month and going into the start of treatment was feeling like we were now taking action to do something about it, whether that was getting the second opinions, doing our own research, understanding what questions it is that we need to ask. It was feeling like we were taking action that was helping us move forward with this otherwise very scary diagnosis. But the support of my parents, my husband, family, and friends was definitely priceless as well.
Yeah. And Martin, if I remember, you're telling us your story, you immediately needed to connect with something that was aspirational, to help you in this incredible moment of having your life also crumble as a newly minted PhD neuroscientist, all of a sudden being told you have pancreatic cancer. Tell us a little bit about what happened in that hospital room.
Well, I think two things happened. First of all, I realized that knowledge is totally overrated because, as you said, I just had a PhD on the topic of stress and emotion. So on one side, I knew everything what was going on in my mind. On the other side, I couldn't use anything at all of that. So I was totally overwhelmed. So that was the first thing that happened. The second thing that came a bit later, some weeks in the treatment in one of my first chemo, that I asked myself really like, okay, what do I want to do when I get here out alive? Because obviously when you get faced with cancer and pancreatic cancer, you think about, okay, maybe I'm not going to make it. And so I thought about the most crazy thing that I could imagine. And I signed myself up for a triathlon out of the hospital room. Now, I have to add two things. First of all, I didn't do any triathlons before, so I was not into this kind of sport. It was just like trying to do something totally crazy outside of my comfort zone. And what I also want to add is this was like my way of coping with my fear. And coming back to this backstory, you know, it seems like, oh, okay, Martin is doing this triathlon, it's amazing, like this marathon or this let's say Hollywood story. But in the end, the deep motivation to do that was fear. I was really scared, and it was my coping mechanism that I was like this, let's say, macho approach, like this man approach. Okay, I'm gonna be strong, and this was something that was helping me and definitely activating me. That's for sure. Yes.
But it's interesting to have the two of you. You're like bookends. Here's Parul in her most feminine maternal part, just having given birth, faced with the same existential challenge, and you are there sort of saying, hey, you must have believed your body was capable of doing this, right? Or you wouldn't have signed up for a triathlon. So tell us, both of you, tell us a little bit about that energy. That, you know, where did you find that energy, and what sustained it along the way for those early months? Starting with you, Parul.
Sure. So, you know, I will say that I was convinced right from the moment I got the diagnosis that, okay, this is going to be hard for the coming months, but I'm going to be okay. And it could have very much been delusion, but I was just feeling that I had to believe that because I had two young daughters to raise. And it is that belief that what I'm facing is challenging, but that I will ultimately prevail and that I will ultimately be stronger because of it was a driving force in how I approached my journey. So even blogging the experience and starting that new job, new baby, new cancer blog, it was a way of finding a purpose within this hardship that I'm now going through. And that purpose was for my experience to not be one that goes in vain, but be one that can serve as an inspiration to others, be one that others can then, you know, tap into if they need their own source of information or inspiration down the road. And honestly, I'm a scrapbooker at heart, and my daughters were, thankfully young during my treatment, but I knew that there would be a time when I would want to be able to share the experience with them, and that they would want to be able to better understand it. And so blogging for me served as this very therapeutic outlet of finding a purpose and knowing that the root of it was one grounded in positivity and inspiration. And that mindset honestly helped shape my entire approach to the diagnosis and to my treatment. And it was definitely a emotional roller coaster. There were definitely tears and breakdowns and regressions, I suppose you could say, along the way. But that overriding emotion of positivity and that I'm going to thrive from this, it was a great source of energy.
So before I turn over to Martin, roller coasters are sustained by supporting beams. What were your supporting beams in those early months of your cancer experience?
A very strong support beam was my family. My husband was my immediate rock when it came to helping quarterback the care and care for my daughters, but also my mother and father, who were here to help with the newborn, but that quickly turned into a one-way ticket. And they, my mother was the mother to my newborn that I simply couldn't be at the time. And it was also the outpouring of love from friends, but even strangers who would send care packages because they had heard, someone who had gone through a similar experience of their own and had heard that I was going through this. And I received a care package of this jacket that was going to be helpful for me during surgery. And it was the love that I felt that was just so overwhelming from everyone around me that it taught me how to be a better friend. It taught me how to better support others. And, through that, also realizing the importance of being willing to be open to that support, to the power of being willing to be open about the difficulties you're facing, the needs that you have, how others can help you. That openness definitely, strengthened me from all the support that I received from friends and family. They were very strong beams.
And that openness, in a way, means you're also sharing or exposing some of your vulnerabilities. And I'm pretty sure that's not what they taught you at Harvard Business School.
I've been asked a lot about vulnerability and how, isn't it scary being so open and vulnerable with your hardships? And I've said that the more vulnerability I've shared with the world, the more the world has embraced me in return. And I've only found love and strength from sharing my hardships and sharing my vulnerabilities, that, there's a lot of power that can come from that as well.
Turning it over to you, Martin.
I totally agree. I'm so thankful for what you're saying and sharing, Parul, because sometimes we come to this idea that we should be strong, and that like showing strength is like something that needs a lot of courage. But I think it takes actually more courage to show weakness or vulnerability, and like showing okay, I did a triathlon and showing a finisher picture. Yeah, that's cool, but it takes actually more strength to go on stage and cry in front of a crowd and say, hey, look, it's really hard. It's really hard sometimes, and I'm also just human, and it's part of the human experience to go through cancer. And I think there is a lot of strength in that, and we can actually get out something of it, an energy or something that connects us on an empathic level if you are able to share that. So it's very, very nice what you just said.
So in thinking about your own emotional roller coaster and the fact that there are support beams that hold it up to prevent it from crashing, what would you say were your support beams, Martin? And what are they now?
Yeah, definitely family, friends, and loved ones. I mean, this is like really something that helped me a lot. also going through the treatment, but then also going through the triathlon. I did the triathlon with my brother and one of my best friends. And this was very symbolic that they were like running and sweating and suffering next to me. And so definitely this helps a lot. I think what's interesting, somebody was putting a question in the Q&A, like that sharing that music helped him or her a lot to go through it. And I think what's really important when we go through such an experience to find out what is actually working for you. I mean, I give you an example. One of my chemos, I realized the chemo protocol was very annoying. It took me like 6 to 8 hours in the hospital before I could go home. And so this is not a nice day at the hospital because you're slowly getting really like nausea and sick. And so what I did, I took with me my laptop and like some comedy shows, which sounds like strange, but it helped me a lot to distract my mind and just like not thinking too much about what I'm going through, but like to laugh and to like focus on something that is distracting me and has some uplifting beat. Like finding those kind of resources. Today for me, it's definitely sports. I love it. I like to move my body. It gives me a good feeling and the feeling of safety. And of course, going to the nature. I mean, I live in Switzerland. I love the mountains. I love sailing. Going to the sea makes me really connected. So these are definitely resources that help me a lot.
So let's talk a little bit about your relationship to your body and your physical symptoms. We also think about, for women especially, hair loss during chemotherapy can be very traumatic, and there's a symbolic scenes of loved ones who shave their head in sympathy or solidarity. For men, it may be, loss of muscle strength or other things that are really very, very confronting. How did each one of you deal with the unpleasantness of the physical sensations of either cancer or cancer treatment during the time that right after you were first diagnosed? Parul, I'll turn to you first.
Well, I believe our bodies are very magical. I actually had written a blog post about how I had gone through pregnancy and now how I was going through a cancer diagnosis, and how in some ways the impact on my body was and like impact on hair and things like that were similar, and yet in one element the body was creating life, and in another experience the body was destroying it. And when it came to the side effects and it came to the hair loss, I wanted to approach those with trying to find moments of empowerment. So there's so much that is out of our hands when it comes to facing cancer, and all we can do is ride the side effects and work to manage them as we can. But when it came to hair loss, that's something that I knew was going to happen, and I didn't want it to just be one more thing that was happening to me. And so the decision to actually proactively shave off my head earlier on, before it just all came falling out, actually turned an experience that otherwise could have been much more painful into one that was filled with strength, and actually helped me feel empowered and very powerful during an otherwise difficult journey. I remember my dad looking at me after the head shaving and saying that my head is 100% certified round, because I had been concerned that it's going to be all bumpy and I wouldn't actually, know what it looks like. But I think, hair loss and how you approach that is definitely a very personal decision. I had gone into the experience expecting to wear a wig and had actually picked out a wig. And I realized that the one day that I wore a wig to like an outing, that moment actually for me felt more inauthentic. I felt more self-conscious about, the fact that I had no hair and that I was now trying to cover it up with this wig, and I didn't know if the wig was fitting right. And so for most of my treatment, I actually wore my bald head with pride. You know, if it was cold, I might put on a scarf, but I would go out and about and have my fully shaved head. And it was, you know, sometimes convenient to not have to worry about making my hair when it was so short. But I never could have imagined that that's how I would approach it, or that that's the mindset that I would have. And I think oftentimes, until our resilience is tested, we don't know what shape it will take for us. And it's just reminding us ourselves that we're all stronger than we sometimes think.
It sounds like having some control or some power over the experience was really helpful for you.
Absolutely.
And what about you, Martin?
Yeah, it's an interesting topic. I mean, because no matter what kind of treatment you're going through, you will have effects on your body, and you will, I would say, have to find a new relationship to it. I mean, no matter if you lose your hair or you lose a breast or you lose like a part of your body or you get big scars, there is just something that makes you feel humble again, and realizing, okay, now it's not up to me. Now this will stay for the rest of my life, and I have to to accept it somehow, and also realizing that your body needs time. It needs time to heal. So this was for me a big learning, that at the beginning I just wanted to push too hard and not accepting it, and to actually to learn to slow down and realizing, okay, let's say me and my body, we are in this together. Like if I push now too much, it will not like be beneficial in the long term. And realizing, okay, now it's the body who is actually dictating the tempo, or like what I'm able to do and what I'm not able to do, and I just have to follow the body. And this was a very interesting learning, and I definitely have a new relationship to my body today. I adore it in many ways, like because it went through so many surgeries and chemos, and it's still here and it's still recovering. And my last surgery, I had the fastest recovery ever, despite it was the biggest one. And so I'm like, whoa, how is that possible? And I think it really taught me a new kind of relationship, or let's say love or self-love, for this magic thing called body, and like what it can do.
So Martin, can you talk a little bit more about that self-love, or I'll call it self-compassion, how you can be in a place of such utter vulnerability and sort of turn some of this very loving energy sort of inwards? Tell us a little bit more about that.
Yeah, with pleasure. It was not something that came intuitive to me. It is something that I developed over the last 8 to 9 years, that I just became more and more sensitive to like shifting from, let's say, a mindset of I have to fight this, like fight against my illness, fight against cancer, and realizing, okay, I have to, or I can relax into it, I can hug it, I can like approach it with more softness. And that doesn't mean that I'm weak. It just means that I'm able to actually accept what is, and I'm not losing energy, because I realized I lost a lot of energy with just like fighting it. And actually hugging it, or having self-compassion, is, once you get into it, it's a wonderful energy source, or a source of like empowerment. And it is not something that came intuitive, but like step by step, I managed to just cultivate it more in my daily life with small little things, like what I eat, how I sleep, how much I work. I work very consciously. I make sure I don't experience like stress. I think it's really, really dangerous for the body. And so I make sure that I don't overtake it, because I know it's a long game. Like if I want to stay into this, I really have to become a good team member, me and my body, and like taking all this into the equation. Yeah.
I'll let you think for a moment and turn to you, Parul. You have spoken very openly about your experience as a receiver of care, and then as a caregiver for your own mother when she had cancer. Can you reflect a little bit on that and on the switch from receiver to giver of care and how your own experience informed your caregiving.
Absolutely. So the reason I was paranoid when I had first felt my lump in the first place was because I had had genetic testing done. And I had learned before that I have a mutation in the BRCA1 gene, which would give me a heightened risk of both breast and ovarian cancer. And over time, I was trying to convince my mother to also get this genetic testing done to understand what her risk might be and what proactive measures we may need to take. And along the way, we did in fact confirm that she too carries that mutation. And, she had had early onset breast cancer in her 30s. And so was already very proactively managing screening for breast cancer. But it was ovarian cancer that I was concerned about because it more than 85% of the time is identified at a later stage because the screening methods aren't as effective and it is harder to diagnose earlier on. And so when we confirmed she too has a heightened risk of ovarian cancer, I literally spent a year giving PowerPoint presentations to my parents about how your risk increases and how if you were to take proactive measures like a prophylactic removal of the tubes and ovaries, how that risk then decreases. And understandably, it's a very personal and very difficult decision. But she did ultimately decide to go ahead with that proactive surgery. And, she actually came, flew down to California, came to Stanford for her treatment and, or for her surgery, which was, again, meant to be preventive. And we had thought that it had gone perfectly fine. A week later, we got the results saying that the biopsy on the removed organs actually showed that there was already cancer growing in the tubes. Mm-hmm. And that we had just miraculously caught it at stage 1 when it is still treatable because we had gone in for this preventive surgery. And it was so high grade that had we even waited a few months, until the end of the summer, it would have been spread all over. Now my mother still had to undergo additional surgeries and chemotherapy, but her prognosis is as strong as it ever could be. And the reminder and lesson that experience with my mother showed and my own personal experiences was that you have to be your own advocate. Whether you are the patient, whether you are the caregiver, you need to be as in touch with your body as you can and be the one asking the questions, pushing for that second opinion, making sure that there's an understanding of any recommendation that's given to you. Because I could have easily believed my lump was a clogged milk duct. My mother could have easily not gone with any sort of preventive surgery. And both of our prognoses would have been so very different at the end of it all. Mm-hmm. I think in addition to learning how to be an advocate, both as a patient and a caregiver, I think the experience that I had gone through myself also then helped me hopefully better understand how to be there for my mother, not just as a quarterback for her care, but also just as a shoulder to cry on and let her know that there are those days when it just all hits you and the best release is to let it cry and that is totally okay.
Well, it sounds like you and your mother have shared some very intimate moments over the last few years with your cancer diagnosis and then her unexpected cancer diagnosis. It has had quite an impact on your family. How is she doing now?
Thankfully, she's in remission and just continuing to manage her screening. And, so knock on wood, we've had our share of roller coasters for sure, but we actually consider ourselves lucky because there are so many people out there that don't have the same, access to resources that we did, or were, able to detect their cancer at that more earlier treatable stage. And so, there's so much that you learn about life and what's important going through a journey like this. And I think for us, one of those things is just gratitude and recognizing how much we have to be thankful for.
And so let's talk a little bit about that, the feelings of gratitude. You founded a company called Silver Linings. I imagine it has to do with sort of finding unexpected treasures, perhaps, in some of life's experiences. And so for both of you, I just wonder, let me start with Martin. Has there been a silver lining for you in this experience, or have there been moments of joy that have resulted perhaps from some of the tribulations or the consequences of having faced this illness at such a young age?
Yeah, absolutely. It sounds maybe weird, but absolutely there were many moments of joy. And if I would have to summarize it, I think it comes down to this talk in a way, like I would not be doing what I'm doing today. So I would not be sitting here and giving a lecture for Stanford if I would not have gone through all this horrible experience. Cancer really made me realize one thing: time is limited. And it sounds so simple and so like, we heard it many, many times, but it's really that, like, time is limited. So really think about, or at least this was what was triggered inside of me when I got faced with the situation, that I had to think about, okay, what do I really want to do with the time that I have left? So pancreatic cancer has a really, really bad outcome or prognosis. And so I wrote the bucket list, I wrote everything I wanted to do. And I did all of that. I spent all my savings. I did all of that, and I was still around. And I was like, oh, maybe I should get a job again, And so it was definitely activating me. And I would not have dared to do that and to live my life in the way I did. And I'm very grateful, because it was boosting a lot of my development and a lot of decision making. So I was not scared of life anymore. And I think that's one of the best things that can happen for you if you have to go through cancer. Next to all the horrible experiences that you will have, it just activates you so much. It wakes you up. And you realize, like, really what matters and what doesn't. And that's a gift, especially if you can experience that at a young age, or at an age where you still have some time left. It's really something that is precious.
And what has the silver lining been for you, Parul?
So I have a different view of silver linings than people often do, especially in this past year. I think the phrase silver linings has been used so often, and it often refers to something more passive, almost like a positive side effect that just happened to come out of a difficult or hard situation. And my view on silver linings, and the reason I went into this field and named the work that I do silver linings, is because I believe that they can be created. And my slogan is, designing silver linings, because I believe that with the right mindset and with the right advocacy and with the right sort of openness to opportunity within a time of hardship, you can actually create those positive outcomes for yourself. And when I reflect back on the past 6 years since my journey and of my remission, there are so many positive experiences that have come out of that. Saving my mom's life is one that was rooted in my own original understanding of my genetic risk and my own diagnosis. There's a whole other story of how we managed to restore my dad's hearing by getting his diagnosis corrected, through resources that we were only given access to because of my own diagnosis. But these are all outcomes that they didn't just happen. They were created by advocacy, right? Like, continuing to understand what is important, what is now an opportunity, what is a resource we now have access to because of this hardship, but that could be helpful in a different situation. And so, yes, there are a number of silver linings that have been created out of my hardship. And, one important one is what Martin touched upon, which is this realization of what is important and what your priorities are. I think we often hear about how the experience of going through chemotherapy ages the body, but I believe it also matures the mind. And I feel like I went through an experience in my 30s and had this realization of life is short, and what is actually meaningful to me? What is the legacy I want to leave behind? What is the impact I want to have on people? And I feel like it's this unique opportunity that I had that realization in my 30s, when that often is a thought process people don't start thinking about until their 50s or 60s, if not even later. But having that realization earlier on allowed me to pivot professionally and focus my personal time on the impact that I want to leave behind, which is, championing advocacy, championing resilience, and helping others thrive from their own hardships.
It's very inspiring.
I
So
just want to add, I
ahead.
really like that what you said, Parul, like creating silver linings, and it's about being like perceptive for what is happening and going on. It's like it's such a game changer once you get it, that life is not only about what is happening to you in life, but also like, are you actually open to what is happening? And then when you have an opportunity, go for it. And I think what is so deliberating with cancer is, at one point you have nothing to lose. I mean, it sounds very horrible, but this can also be deliberating, because then you just go for it, and that is very, very activating. So I can highly identify with what you said. And also the saying about it what did you say? It breaks the body, it makes the body old, but it matures the mind. I love that. That's really good.
Yeah. So we have a lot of people joining us in the chat from all over the world, not only Palo Alto and Burlingame, but Tampa, Florida, and Atlanta, Georgia, and Oxford in the UK, and Oslo in Norway, and somebody in Zurich, probably your best friend Martin, and somebody in Berlin and in Cologne. So we have a lot of Germans. And then Francisco in Mexico says he wants to tell us about his experience. So Francisco, go ahead and write it in the chat, and then we will share it. And we have a question for you from Francisca. And she says, what are your thoughts on stress and cancer?
Yeah, I mean, I can go first if you don't mind. You know, I want to start with, like, cancer is really complicated. So I want to put that into like the frame of like, it's not that simple that you can say, okay, you have stress and you get cancer. It's a very complicated illness. But what we know is that stress is really, really not good for your immune system, for your body. And if you're stressed, especially chronic stress, I mean, there is good stress and bad stress that we also have to differentiate. But if you have like negative chronic stress, that is really, there are a lot of studies out there that it actually decreases the efficiency of your immune system. That is not what you want while going through cancer, or even before. And so I definitely think there is a correlation, which doesn't mean that it is a causality, but my personal approach to it is that I really try to reduce negative chronic stress, because I think it's not only bad for your life quality of life, but also for your body.
Yeah, I would just add that to Martin's point about cancer being incredibly complex, and the drivers of it so variable from person to person. I think in my particular situation, there was a genetic element, and there was a genetic predisposition to being at higher risk. For I think like 80%, I'm not a doctor, but I think for like 80% of cancers, it's more sporadic. It's more and based on just environmental elements. And so, I think there's a lot to be said about the products that we use and the impact that those have on our body, and study that needs to be done and understood around their impact and relationship to cancer. When I think about stress specifically, I would say definitely join the next session that we're having, which is all going to be about managing stress, and the next two sessions rather on understanding mindsets and how to manage stress. And part of it is the mindset that you have about stress, and like Martin said, where on the spectrum does that stress fall? Because stress can be beneficial, and it could energize you and help you perform in crunch time. But if it's the other end of the spectrum where you believe it's going to have all of these physical ailments to you, then yes, it can be incredibly harmful. And being able to understand how to shape that mindset and how to manage your stress levels in your life so that they are, are encouraging to you or beneficial to you. It's the same about just whether it's negative relationships, negative career, if you have that luxury of choice, then being able to surround yourself with positivity and manage that negative stress is critical for all of us.
So Anna has just asked a question that has been on my mind as well. And we know that fear of cancer recurrence is very difficult to bear for many who are cancer survivors. How have you each dealt with these fears? I imagine they've bubbled up now and then. Martin, do you want to take that one first?
Yeah, sure. It's a very good question. It's a very important question, and I love to answer it or like share with you my personal approach to it. So I start with the fact that we have to understand that fear is the most human basic emotion there is. Okay, so fear in our brain is so hardwired that we should avoid or like give up this notion of like, okay, I get rid of my fear, because cancer is a threat and it's about living and dying. So of course you're going to experience fear, and you're going to experience fear of recurrence. And once you get that into place, you can maybe approach the whole situation from a different angle. What I learned from all my like recurrences, and I had many, like my illness is kind of chronic, is the only thing that gets normal is that it doesn't get normal. Like when you're sitting in the hospital room and you're waiting for your scan results, it's scary. And it's scary even after 9 years. And the only thing I learned is, that it's scary. And I can sit in that and I can hold that fear, and slowly it doesn't completely dissolve, but I just know, okay, this is now part of the experience, but I still can walk in the hospital, I can do it, and I can function. And I'm not like letting that fear completely taking me over. So fear coping, I think we can normalize it by just understanding that it's a very, let's say, normal emotion. And often people say, or have a misconception, say, okay, they are like good and bad emotions, and emotions are not good and bad. Emotions are comfortable or uncomfortable. And once you understand that uncomfortable emotions, you can hold them and sit with them, you actually start to master them a little bit more, and then they don't master you. But as with a lot of things in life, it's a lot of practice, and just like not letting it, getting it too hard on you, like just trying to make one little step at a time. Yeah.
Wonderful response of not allowing yourself to be crushed by those feelings of fear. What about you, Parul? How have you dealt with fears of recurrence?
One step was actually just from how I even approached finding comfort with what my treatment strategy was going to be. I was very surprised when I got diagnosed, and maybe this is just based out of ignorance, how so much more of an art than a science it was in figuring out what treatment plan to go with. And I felt like I was being given different suggestions of different chemotherapy drugs, and almost being asked, like, what would you like to do? As opposed to being told by the medical care team that this is what you should do. And I had an entire thought process of wondering, well, what if I went with this, more progressive treatment, and that's less toxic, and my hair might not even fall out. But then what if I were to have a recurrence? How would I feel about that trade-off versus, an even super toxic chemotherapy that might reduce my risk of recurrence, but might have other longer term side effects. And the decision-making paradigm or framework that I sort of like created and used for myself was the path of least regret. So the path of least regret was, for me, proceeding with a treatment plan that I could have peace of mind with, and that no matter what would happen down the road, I would at least feel that I made the right decision with the information that I had at the time. And so one element of overcoming my fear of recurrence is remembering that I made the best decision that I could. That doesn't mean the fear is not there, and that the fear doesn't sort of pop up every now and then, because over the years there have been, I had a bilateral mastectomy and reconstruction, and so the chances are very slim, and yet there would be like some kind of irregularity in my skin, and I would immediately be very paranoid and immediately feel like, oh my God, I need to get this checked out right away. And it's about balancing the benefit of that fear and the bias to action of staying on top of any potential red flags and continuing your screening and making sure you're managing your health, but then also just not letting it consume you, knowing that you're making the right choices and decisions that you can with the information that you have, and that you're being given this chance of life to enjoy it and to make the most out of it, and not let it be consumed by this fear and negativity. As much as you can battle it.
You are both amazingly self-aware. I just want to comment on that for those of us who are listening or watching. Martin, I didn't mean to interrupt. Please go ahead.
No, I think Parul, you're raising a very interesting point, because what you could try out and play around with is reducing the time window where you allow the fear to be part of your life. Like, fear will be part of it, but let's say you have a scan in 2 months and you're fearing today that this scan result will be bad. What is the result of it? The result is that you're destroying today, like the time that you have today. So what you could try to play around is like, say, okay, I'm gonna allow fear, let's say the day or the week before my scan, but today, like it's today. Like, I don't allow the fear to be part of this whole environment or this day I'm in. And I mean, you try it out, play around, don't take it too serious, and just see if it works. And I so far managed really to have this window reduced to the 2, 3, 4 hours before I get actually the result. And it's just like playing around with this time window. That's just, I wanted to add, Lidia. So I also didn't want to interrupt you. Yeah.
Martin, you talk about it as if this were a camera and you are deciding on the aperture of your lens. That's so fascinating to hear the two of you speak. Fernando from Mexico talks about the fact that perhaps mental health is very important, because in the back of people's minds is this existential fear or the thought that cancer could potentially lead to death, right? So tell us a little bit about your experience working with mental health professionals during your cancer journey, or what you think is the role of support for mental health for people living with and beyond cancer. I'm looking at you, Martin.
Okay. Yeah, I don't see you like you're looking for. I think it's a very important point, because the whole cancer treatment, I don't know how it's in the US, but here in Europe or Switzerland, it's really focused on the body. You know, you have like surgery, you have chemo, you have radiation, you have like everything focuses on the body. But then there is the second aspect of the illness, which is mental health or mindset. And it's absolutely an important aspect of going through cancer, because once you have, let's say, a strong mindset and you work on your mindset and you train your mindset, you will also empower your body, and you will also empower like how you go through the illness. What my experience is that people like can understand that you can train a mindset. It's not like when you look at Parul and me, and you would have made this talk, let's say 10 years ago or 8 years or 5 years ago, you would have had other answers from us. So we got a lot of training, like we didn't sign up for it, but like a mindset and resilience is not something that is just in our DNA. It's something that we can actually build up step by step and making it stronger. And I think that can be very motivating, you know, like maybe you are now down and you cannot like handle it. So give yourself a break, like allow yourself to recover and then take it from there. And like every day you can like get a bit closer where you want to go. I don't know how it was for you, Parul, but this is like my experience.
No, I think when it comes to mental health and mental well-being, they play a very powerful role, not just in our neurological and behavioral sense, but also our physical health, and making sure that we're nourishing those, you know, whether going through a diagnosis and a treatment or, you know, years beyond that, is incredibly important. And I think part of it is being aware of what your own personal needs are. And if the need is to speak with someone and to be able to talk about your experiences or your feelings, because even I experienced that when I was like actively in treatment. Everyone's asking, right? Friends, family, everyone's asking, like, you know, how are you doing today? And you know, how was the past week? But as soon as I went back to work, and as soon as you know, the chemotherapy was over, even the surgeries might not have even been over yet, and the personal impact to me definitely was not over. But as it externally appeared that I was now returning to this new normal, those questions stopped being asked. And it's not that I necessarily had a problem with it. Obviously, we all move forward, but that doesn't mean that I wasn't finished talking about it. And so I think part of it is being aware of, you know, of recognizing that it's okay if you know, if help is needed, being willing to seek that help, and you know, when it comes to mental well-being more broadly, that there are tools, there are skills that can be built up. There are steps to building up your own resilience and your own mental well-being. And you know, part of that is just being aware of what energizes you, how you can channel your thoughts towards what you have to be thankful for, and practicing that positivity and practicing that gratitude. And so it really is variable in regards to where on the spectrum of mental health and mental well-being that we're talking about, and whether external help is needed or it's something that can be worked on internally. But they're incredibly important for both our physical and, you know, spiritual selves.
So we have 1 minute left, and I wanted to give you each an opportunity to just make a final comment, and then we'll close it, and hopefully we will be able to meet again in a couple of weeks. Go ahead. Parul, why don't you go first?
Sure. You know, I would like to start off by just thanking you for creating this forum and having us, giving us the opportunity to share our stories. I think there is so much learning that can come from experience sharing, and hopefully opportunities for inspiration to help others that are going through their own hardships. And I would just want everyone to walk away with knowing that they are stronger than they might realize, and that every hardship is an opportunity to create their own silver lining. And I wish you all the best.
Thank you very much, Martin.
Well, I think I would just add a little reminder that helped me a lot in the dark days, that I ask myself, what is the smallest step that I can do today so I feel better tomorrow? And that doesn't have to be something extravagant or something outstanding. Just like, what is the smallest thing I can do today? I feel better tomorrow. That helped me a lot. Maybe this is a nice way to close this session. And I wish everybody who was here on the call all the best in their own journey. It was such a pleasure that we could like share with you guys our story and what we learned from it. Thank you.
Well, on behalf of all of our listeners and viewers, I want to thank both of you for sharing your stories. In the next program, which will be 2 weeks from today, Parul and Martin will interview one of our Stanford faculty, Professor Ali Crum, who is doing a lot of research on this in this very exciting area of cancer mindsets. And 2 weeks after that, you will watch Parul and Martin again interview Professor David Spiegel, who will also deal with issues of stress. So be well, stay well, and we hope you can join us again in 2 weeks. Thank you very much.